The best thing about ORMC is the people. Open lines of communication, people who will go out of their way to help you, as friendly of an environment as you could imagine.
Initially, when I came to interview and explore the community, it was a matter of need. They had some need for orthopedic surgeons who specialize in sports and shoulder surgery. When I got here, though, it really was the passion of the community, both within athletics, but also the passion of people working out in the oil fields and especially within the hospital, the passion of the people I work with every day in the hospital.
Once I met the whole healthcare system, I just knew this is where I wanted to be. I felt the goals that Odessa Regional Medical Center has, they align with my goals. I knew I could make a difference in this community, and I wanted to give back to a community that has given a lot to me.
I think the leadership for the hospital system is really rooted in the area, which is kind of what you want in a hospital leadership program. You want people who care about the hospital and the community at large, not just the bottom line.
The major problem what we have at this moment as far as the heart is concerned is acute coronary syndrome. Acute coronary syndrome is a scientific cardiology related word, so I will say probably a heart attack is the right word to be, is an appropriate word for that. We have a service in combination with the paramedics team as well as the ER here and the cardiologist, so-called chest pain center team. The moment somebody is having chest pain or the heart attack, we wheel them to the ER and quickly take them to the cath lab and open those arteries up so that they don't manifest sudden cardiac death or any damage related to the heart attack. And thereby we improve the survival in patients with the heart attack. And this is one of the major services that we provide at Odessa Regional Hospital and is accredited by American College of Cardiology.
We try to provide the patient the complete cardiology care, everything from diagnosis, testing, treatment plan, those type of things. We do cardiac catheterizations, stent placements, pacemakers, defibrillators, pacemaker checks. We also do peripheral vascular disease. We do non-invasive testing with Doppler evaluations, echocardiograms, those type of things.
Recommendations for a healthy heart: number 1, exercise, aerobic; number 2, healthy diet; number 3, avoid smoking and excess alcohol intake, and maintain a healthy weight. And always manage risk factors like high blood pressure and diabetes.
The most common problem I treat in the clinic is probably coronary disease and congestive heart failure. It's our goal as a physician to have all our patients go back to their livelihood and be back to their normal self from illness. That's our goal.
Minimally invasive surgery offers a lot of benefits because of the small incisions, less scarring, shorter recovery time, and lower risk of infection. Most advancements in minimally invasive surgery recently have been in the robotics area. The robots are less bulky now, more maneuverable, easier to use. The cameras are a lot higher quality and definition. I've been here for 23 years and done a lot of surgery in this community over that period of time. When it comes to the robotic surgery, currently I'm the most experienced robotic surgeon in West Texas as we approach 1,000 robotic surgeries. We've been doing this at Odessa Regional for about 4.5 years.
So minimally invasive procedures are very important, particularly for gallbladder disease as well as hernias. They can be performed with smaller incisions, which means less pain to the patient. Also means that the patients can get back to work sooner and back to their normal activity sooner. So with the advent of the surgical robot, it allows us to treat patients and have them get back to their normal activity and work in the matter of days whereas older techniques would require them to be out of work for weeks.
I chose vascular surgery because it's a very technical specialty. It's very demanding. You really see the results very quickly. If the patient do well, they really see the result of your surgery or procedures very quickly. So that's very gratifying. And also vascular surgery is constantly evolving. There's a lot of newer type procedures. So what I learned about vascular surgery 20 years ago as a medical student is completely different than what I do today. So I find that very exciting.
When we talk about shoulder reconstruction, it's used to describe sort of a range of procedures depending on a patient's age and what they require. So some of our younger patients, they have problems with things like instability and shoulder dislocations. And so for things like that, we have a range of reconstruction options that are typically arthroscopic, although sometimes open. As people get it out of young adulthood and into middle age, they have more problems with their rotator cuff. And so the term is used to describe arthroscopic procedures used to repair the rotator cuff. And then as we get older, sometimes we have to do replacement type procedures, like a total shoulder replacement or a reverse total shoulder replacement.
So as a fellowship trained hand and upper extremity orthopedic surgeon, I've been trained to treat any injury of the upper extremity. That includes any fractures of the hand, wrist, forearm, elbow, arm, or shoulder. I can treat any kind of tendon injuries in the hand, wrist, and elbow, as well as rotator cuff procedures in the shoulder.
The whole fellowship experience allows me to perform patients with complex hip and knee problems like fractures, deformities, significant destruction of bone. In these scenarios, my additional training helps me in accepting cases that other providers would not accept in this region.
Family practice, I mean, as far as our role in healthcare, we're kind of the quarterback of the team. That, you know, we're the first point of contact. People come to us when they have the problem. We're making the decision of which running back gets the ball, so to say. We're looking at, you know, okay, you need this test, you need this x-ray, you need to see this specialist. And then we facilitate that. And then we have to take that information and assimilate that information and bring it back and help to decide what to do with it and what's right for our patient. I love the relationships of the families. I loved seeing from the baby to the mother to the grandmother to the great-grandparents. I've had 5 generations of a family in my care and deliver and be there to take care of the newborn in the hospital of a new baby and take care of great-grandmother on her deathbed in hospice. That is a very privileged and very special thing to be a part of, and it's an honor.
I think preventive care is very important in a healthcare setting because the earlier we pick up the health condition or any disease condition, we can educate the patient and they're more involved in their health care. Once the patient is involved, the outcomes would be much better.
So the beauty of family medicine is that we are trained to see toddlers, babies, newborns, all the way to 100 plus. And with that, it's very convenient for a mom or dad to be able to come and bring the whole family for one visit instead of having to do multiple visits. And the fact that we are able to treat different medical conditions also very convenient because they don't have to listen to different opinions, different specialists, and I think patients do really appreciate that. Treating the underlying problems is very vital in treating the big picture. It's very easy to slap a Band-Aid on a wound, but it's very important to get to the root of the problems in order to treat it correctly and not have to continue to treat it. And most conditions, if we don't treat them well, they lead to more conditions. So it's very important to treat the root of the cause in order to be able to efficiently and well treat your patients.
I actually had an interest in pediatrics, and when I rotated through family medicine in medical school, I just love the variety and the complexity that you get with adults. Being able to treat the whole family is very rewarding. When it comes to the practice of medicine, team approach is very important. We need to all respect one another, but if everybody can communicate well and interact well with each other, it just helps the patient in the long term and helps with efficiency, and it also makes it easier to go to work.
I've come to believe that life has seasons, and if you want to be doing well in your winter season, you better be taking good care of yourself in the spring season. Because I talk to my patients about being aware of what is going on with their bodies, that when they do have issues like diabetes or hypertension or smoking or things like that, how it can affect them later. And when they finally get to that point, whatever changes have occurred, there's no pill to fix that.
I think it's really important to take time and listen to your patients. They'll tell you what's wrong with them most of the time if you just give them a few minutes to talk and listen to them. And they need that. They need to see that you're taking the time to hear them and show that you care about them.
Well, because I have a lot of athletes as my patients, it's important that you take a team approach to their care. This involves the coaches, especially the training staff, who I have regular contact with, and I think in that way, the surgical procedure itself is really just a small part of the overall health of the athlete. This includes physical therapists, all the nurses in our clinic and in our hospital.
I think it's important to communicate well with the patients because a lot of times they have some apprehension of coming to see a cardiologist or to see any physician. There's some nervousness, things like that, so we try to keep them at ease and try to provide them good explanations of what exactly is going on or what we think is going on and what we think the treatment plan is and the diagnostic testing that they may need.
As far as determining the best course of action with my patients, I like to take a team-based approach. I feel it's my job to educate the patient on their problem, their diagnosis, as far as what the actual issue is. And then I like to walk them through the different treatment options regarding whether it's non-operative management with injections or bracing or the surgical options. I like to educate them on what their expected outcomes are with both treatment arms and what their goals are for them. Just because it may be the right surgery for some people doesn't mean it's always the right surgery for everyone. So for me, it's important to make it a team-based approach.
I love that I can wake up every day knowing that even if I make a difference in one person's life, that makes me happy. Just waking up and doing what I love is the best part of my job, and doing it with people with as much compassion and passion for it makes it so much better and worthwhile.